Hello and welcome to Sunset Television. I'm Vishal Dahiya and you're watching our special show, India Fights Back, where we talk about the efforts being made by India to fight this COVID-19 pandemic. Now, 5 states of Maharashtra, Punjab, Karnataka, Gujarat and Tamil Nadu continue to report a surge in the COVID Delhi new cases. Now, 79.54% of these new cases are from these 5 specific states. Maharashtra has reported the highest daily new cases so far, followed by Kerala and then Punjab. The Prime Minister Narendra Modi has recently stressed on the need to take quick and decisive steps to stop this surge in new cases. Today, we're going to talk about those steps itself, what exactly needs to be done, and in terms of not only, obviously vaccination, giving a push to the vaccination drive, but also the COVID-appropriate behavior and the policy of testing and tracing also. So for more on this, we're joined by 2 distinguished experts. Let me first introduce them to you, beginning with Dr. K. Madan Gopal. He is a Senior Consultant Health with NITI Aayog. And we're also joined by Dr. S.K. Singh. He's a member of the National Task Force on COVID-19 and Director of NCDC with the Ministry of Health. Welcome, both of you, gentlemen. And let me begin with you, Dr. S.K. Singh. Let's start by understanding the scope of the issue here in terms of the recent surge in cases. How worried should we be?
I think it's a very appropriate question at this point of time. And I think all persons in the community and in the country are worried about the rising trend which is being observed. Previously, it was confined to Kerala and Maharashtra, and now it is being noticed in around 8 states, or to be very precise, in 12 states, and altogether maybe around 55 to 60 districts in the country, which are showing a severely rise of more than 50% of daily new cases. I think that is the one which is worrying everyone. And having said that, I think we have to go into a little bit more detail of the problem or the situation. I would like to point out to the whole country that as of now, the exposure in the community has not been to that extent where we can imagine that the transmission chain can be substantially less. So the exposure in the middle class town particularly has been less. So the pool of susceptible individuals is fairly large, and it varies from city to city. Even if we take the highest exposure in Delhi to the tune of around 50%, as has been revealed by the last Zero survey, we still have a large chunk of, taking example of only Delhi, we have a large chunk of around 70 lakh people who are susceptible. So susceptible pool is one. Second is laxity, both on the part of public for COVID appropriate behavior. That is another, because looking at the downward trend, which was continuing for 2 months, the public has rather started believing that now we are over. So the COVID corona is going to vanish maybe in another 2 or 3 months. So that was another. Third was definitely vaccine, which people thought that will do a wonder. Yes, vaccine will do, but it will take its own time. So I think these are some of the facts. Apart from, yes, some concerns are there about the new variant. Some concerns are there regarding the testing strategies. And so these are also accounting for some of the surge which we are looking at, but we'll talk more about it.
Okay, definitely, Dr. Singh. We'll look at all those aspects, the testing and tracing strategy, also how vaccination is an aspect which needs to be looked at in, coordination with the other steps out there. But let me first bring in Dr. Madan Gopal here as well. Your viewpoint, Dr. Madan Gopal, on the quantum of the problem, the scope of the problem at hand, and are some of us taking it a bit lightly, which is definitely should not be the case here.
Definitely. As Dr. Singh has pointed out, initially we thought that the public health people thought that the epidemic is over. No, it's not over. Following this epidemic, last March we started the rise of the cases, and this is a march against a surge. We are witnessing a surge, mainly in the western and the northern part, and around 70 districts have shown a surge of more than 200% or 150%. And if you look at the surrounding districts of the 70 district, slowly the number of active cases in these districts are also increasing. Initially, the pandemic was more or less concentrated in the urban areas. Now it is spreading to tier 2, tier 3 cities, and slowly it is spreading to the rural areas. That's a cause of concern, because in the urban areas and the well-connected areas, you have good facilities. Now it is reaching the rural areas, and that is a cause of concern, because the infrastructure, whether it's already overwhelmed infrastructure there, whether we would be able to withstand or not. That's why these problems are there. The third, the vaccine, as Dr. Singh has rightly pointed out, it has created a euphoria that now vaccine is there, things are better control, and as a result, lowering of guard has happened. Now we have to see that how we stick to the basic. Lowering of guard has happened, and the basics of epidemic management somewhere has become complacent. That means testing the people, tracing the people, containing them, and isolating them. That kind of measures which we used to take. Vaccination is another tool in that direction. As a result, now we are staring at a second surge of the vaccination, as the other parts of the globe is doing.
Mm-hmm. Okay. That's a very, very significant point out there, which Dr. Madan Gopal has referred to, and I'd like to bring you in, Dr. Singh, there in terms of what we did right in the past year or so, because for us the pandemic began almost around a year ago in India, and what we did right was three aspects: testing, tracking, that is tracing, and treatment as well. And then we did it on a very large scale in a very specified manner, but as Dr. Madan Gopal is saying, do you agree that we have, some sort of laxity has creeped in as far as this basic requirement is concerned? And if that's the case, then how should we, approach the situation from here onwards now, before it goes out of hand again?
No, you are very right. And if we look back to the year which has already passed, I think from the March onwards, we started experiencing the so-called the trend of rising cases in the country. And from one district, we started going with the 733 districts, all districts in all states. If we look at the measures, right from airport screening to community tracing, then contact tracing of each and every positive case, and then going with the stricter measures like having containment zone, strict perimeter control, and having a restricted movement for enforcing the COVID appropriate behavior, then going with the Honorable Prime Minister's call of lockdown, which has helped us in a big way in rather mitigating the total impact of pandemic. I must say that in all the spheres that lockdown has brought definitely a sea change in the minds of the people, number one. Number two, support of the public health measures, which were limited. And the third and most important aspect was that the public started believing that the government can tackle it, and that has really happened. And the toll which has been seen in the Western countries or in the Europe has definitely been substantially less in India, and that is all the impact. I must highlight that the contact tracing, around 2 crore people were contact traced by the community of the IDSP network. That was one. And if we look at the testing also, I think today if we see the numbers, there are around 23 crore people who have been subjected to various kinds of tests. So this is a huge number by any means. I think this particular testing and then tracking and then putting the treatment lines in place, I think we have come a long way from the testing strategies to the tracking to contact isolating and quarantining. And this has all really helped. And that impact was seen from November onwards, when we started seeing decline in all the states. And for last 3 months, when the declining trend was continuing, and that was the time when the complacency crept in, not only in the public, but also in the government sector or in the minds of the persons who were really at the helm of the affairs. So people started seeing that, okay, either they are having herd immunity or some kind of inherent immunity, like Bihar, UP, where the infection did not travel that much. So that was one aspect. Second one aspect was, they said now zero prevalence is showing this much trend, so it is now going to be over. Third important aspect, the downward trend, vaccine coming, euphoria creeping in. So these were definitely there. But now what we should do, was right, yes, tracking, awareness among the public, measures being strictly enforced, and then support of the community at large. So these definitely put us in the right place. Now we have to go back to the basics. I think Honorable Prime Minister was very, very right that we have to, there is no scope for complacency. Although vaccine is there to support us, but only support. I think we should not forget COVID appropriate behavior is the key and will remain the key for another 6 months, if I must say, put it like that.
Okay. That's another important aspect there. The COVID appropriate behavior, that remains the key, and that brings me to Dr. Madan Gopal again here. Dr. Gopal, after the lockdown was lifted slowly, step by step, we sort of moved into the normal life again. But normalcy has returned in most of the aspects of our life. But the pandemic is still not over. It is, we're still facing that problem out there. In that situation, and ensuring the COVID appropriate behavior is fully implemented on the ground, do you believe that we need to go ahead and then further perhaps tweak the regulations and enforcement of the COVID appropriate behavior on the ground?
That is very much needed, but not the enforcement. It's the people. We have to make it as a people's movement. The people should come forward and they should act responsibly. The government, whatever it will do in its might, it will be doing it. It's already doing that. But enforcement of this COVID appropriate behavior, we have to take a call and we have to come forward and we have to act responsibly. When we started at NITI Aayog, the slogan was be responsible and act responsible. That means, if you look at I'm very fortunate and happy to share that all the staff acted responsibly and none of the housekeeping staff till day they are COVID positive. That's the kind of responsibility which these people have exhibited. That kind of responsibility has to come in from the people. If you look at the example which has happened in the Behavioural region, where the people who are isolated, because over the period of time as we have matured in the treatment protocols as well. And maximum number of cases are managed at home. And during the home isolation, if the people jump home isolation and they mix with the general population, what we can do, what the government can do, they can only isolate. They say that the person is isolated. Previously, sticker was there in front of the house saying that the person is isolated, he is COVID positive. Now that kind of, because some stigma and other things were associated, that is now more or less that has been done away. Now if the person is positive, he stays positive, he is in the house, he is isolated, he is home quarantined. If he jumps the isolation, then who is responsible? The government is now coming back, it is renewing its efforts and it is continuing with the basics which we have been doing. As Dr. Singh has pointed out, the testing which we used to do in March 2020, now is almost 10-20 times more than that testing we are doing. And all the states, they are complying with the WHO minimum requirement for testing. They are all doing that. As the things have opened up, contact tracing becomes difficult. It's a very challenging task for the team, IDSP team and the other district team. But here the person who is positive, who is labeled as positive, who turns out to be positive, if he comes forward and identifies his contact and exhibit himself responsibly, then we are on the right path and COVID appropriate behavior can be ensured with the contacts and the other people. Unless that person acts responsibly, it is a very, very challenging task for the healthcare professionals and the district teams. It's very, very difficult.
Okay. Dr. Singh, do you agree with that part there, which, Dr. Madan Gopal is saying that as far as COVID appropriate behavior is concerned, the onus lies with the individuals, people like you and me, and obviously, we can't lower our guard down, and that not only endangers us, but others also, and this then, comes down to rather a behavioral change, something which we've been talking about for months altogether now, that people will have to bring that behavioral change.
No, I think very right, and I agree with Dr. Madan in totality. I must cite here my visit to Maharashtra, particularly the Vidarbha region, Nagpur, Amravati, Akola, Yavatmal. These were the districts which we visited because we went to Bombay, but there we were told by the state government to visit these areas and find out the real cause of this. I must share here the experience which I had in Amravati and in Nagpur. We did discuss the surge in rather more depth, we found that the areas which were earlier affected more are less affected now. Second aspect is the COVID appropriate behavior is another aspect. Third is home isolation. I think Madan has highlighted very right point that the persons in the home isolation are participating in hefty marriages. Their contacts are also participating because there is no stamp. There is no restriction as such for their movement. And with unlocking coming in, people have started participating or traveling from one place to another. I can cite the example of Punjab also here. Nawa Shahar, Kapurthala, there we visited all these areas in the last week only. What we found again, the people who are required to behave in a responsible manner, particularly when they were found to having high contact tracing, I must say, was very, very minimal, 7 to 8 contacts or maybe less than 2 or 3 contacts per case. So if we are tracking only 2 or 3 contacts, how can we achieve the cutting down the transmission chain? So that is one important area. And we are doing the targeted testing in the areas where high transmission is going on.
Does that also not, bring that question again in focus, Dr. Singh, that perhaps because there is no specific, action being taken or the process or the entire system is not exactly the same as it was almost around 6 months ago in terms of, guidelines for those who are positive, and we are expecting people to bring that behavioral change. But if it's not happening, then is it not the time to bring in tweak the containment strategy again? Enforce the rules and regulations properly?
I think we have to understand a little bit more in detail the atmosphere. So unlocking has started, services have started, both in the hospital, non-COVID services are also being started. Our daily routine has started. Somewhere schools, cinema halls, swimming pools have also started. So this is on one part. Second part is definitely the people's behavior. If we don't enforce the things, people have a tendency of going into complacency. So that complacency has to be brought in under control, and there has to be increased awareness and responsible behavior on the part of the people. And they have to be clearly aware that the pandemic is not yet over. We can see the trend in Western world. We can see in UK, Europe, and even in Brazil and South Africa what is happening. So if we don't behave responsibly at this point of time, definitely what you said in the beginning, that we are going to lose time. And the time is not very far. That we will again have, today we are having around 35,000 cases. This has been only 1 month back, we were having around 15,000 or 12,000 cases daily. And now 35. And very soon we will go to 50 and maybe more.
Okay, definitely that threat is there itself. There is one more aspect to this entire situation, and I like to, bring in Dr. Madan Gopal again here. Dr. Madan Gopal, in our earlier strategy, we had this process of testing, tracing, and treatment as well. But fortunately, and due to the hard work put in by our scientists and other stakeholders as well, we now have vaccine as well. So it's just not limited to these 3 factors. It's now test, track, treat, and vaccinate also. That's a very, very important element. So if there is a positive element which has been added to our strategy, shouldn't we, retweak and readjust our entire process, our entire strategy in such a manner that we make use of that particular positive aspect and don't lose ground?
Vishal, it's very interesting question, but the answer is very simple. The answer is, for any pandemic management, you have to follow the basics. You have to first test the person whether he is positive or not. Then you trace his contacts, isolate that person, put him on treatment. Then the remaining people, vaccinate. Vaccination is a solution for preventing that susceptible population. All the 4 things will go simultaneously. It's not that we vaccinate all the people and forget about all the 3 things. Initial remarks I told, the vaccine has resulted that कि कोई जादू का काम आ गया है, जादू की दवाई मिल गई है, and every solution is with the vaccination. No, you have to still follow the basics thing, that is tracing the person, tracing the contacts, tracing the contacts, and isolating them, and treatment along with vaccinating. All the 4 things will go together. It's not now we are having one tool in our armament, that yes, vaccination is also there. That's why everybody is trying to vaccinate as many as the people as possible. In the meantime, you should not be forgetting that this is the basic work which needs to go hand in hand with the vaccination drive.
Definitely, all these factors, all these strategies will have to work hand in hand, and vaccination is part of that broader strategy out there. Dr. Singh, your views there on ensuring sort of not only compliance but also behavioral change when we are talking about, and these two factors, pandemic management as well as protecting the susceptible population with the vaccination drive.
No, I think we have to focus on three things. Number one, the scenario which has been seen in Maharashtra can happen anywhere. So I think public need to be aware. All middle class cities are vulnerable. We have a large susceptible pool. We can't be complacent. Even if we say 3 crore have been vaccinated, that doesn't make any change in a population of 130 crore. That is one. Second is regarding the COVID appropriate behavior. We get the vaccine or we don't get the vaccine. We have to comply with the COVID appropriate behavior for the times to come. Even the vaccinated people have to follow that particular behavior. No complacency, no lowering of our guard on that account. Third and most important part, yes, we need to be strict with the enforcement also. Government and we people have to see that the people who are taking it lightly at this point of time cannot be just left like that, because the impact of small portion of people not following COVID appropriate behavior is being felt in the entire community, entire city, and maybe entire country. So I think we should be very, very particular about all these things at all levels. And yes, starting with the increased testing in the areas which are showing high transmission, that is one. Putting containment zones again in place will be another measure. And third and most important part is the community responsibility. I think all three of these go hand in hand.
Okay, there it is. Thank you so much, Dr. S.K. Singh and Dr. Madan Gopal, both of you, for your views and insights on this very important aspect of the battle against COVID-19. As our experts were pointing out, we cannot lower the guard at this point in this fight against COVID-19. We have so far managed to have an upper hand against the virus, but if we need to sustain this lead, we need to follow the basics of pandemic management, which clearly indicate the COVID appropriate behavior, ensuring the testing and tracking as well. And when we are talking about the COVID appropriate behavior, then it is a simple 3-step process. One, you have to wear your mask at all time, wash your hands regularly, and maintain physical distancing while in public places. This will keep you and your near and dear ones safe and secure. We'll come back again tomorrow with a different aspect of this battle. Till then, keep watching Sunset Television. Thank you.
Watch the big picture.